Tunaendelea na session 2 part 2. So it is part 2 of session 2. In this part 2 of session 2, we will continue with the animal variation or species variation among animals in the issue of drug distribution. So these animals of different species, they differ in the way drug is distributed through them. So drug distribution, it does vary among species, but less so than half-life of drugs. So there is a significant difference between the non-ruminant and the ruminant in the distribution of lipid-soluble organic-based drug. Kwa hiyo issue kubwa sana katika drug distribution ni kati ya ruminants and non-ruminants. Ruminants wale wenye matumbo mengi na non-ruminants wale wenye tumbo moja. Hiyo ni tofauti kubwa sana ambayo inaathiri sana drug distribution. So, tukianza na hawa ruminants. Ruminants kwa asilimia kubwa matumbo yao yana acidic environment. The pH of their rumen is acidic. Halafu matumbo hayo yanakuwa na large volume which holds a large amount of body water. So they have large volumes like the rumen of a sheep is about 25 liters. Huyu ni kondoo, 25 liters volume of the rumen. And a cattle, ng'ombe, the rumen holds about 220 liters up to 225. Kwa tumbo la ng'ombe linaweza kubeba volume 220 mpaka 225 liters. So this rumen which is acidic in nature inaweza kusababisha matatizo kama mnyama huyu atachukua dawa au atameza dawa ambayo ni base. Atameza dawa ambayo ni base. Kwa hiyo kuna concept ya kitu kinaitwa ion trapping. Ion trapping inamaanisha nini? Ion trapping maana yake tumbo la hawa rumen ya hawa ruminants ni acidic in nature. Kwa tumboni ni acidic in nature. Kama mnyama huyu atameza dawa ambayo ni base, manake nini? Manake dawa ambayo ni base inakwenda kukutana na environment ambayo ni acidic. Kwa hiyo dawa ambayo ni base ikikutana na mazingira ambayo ni acidic, nini kinatokea? Dissociation. Ambayo hiyo dissociation itatengeneza charged particles. Kwa hiyo asidi ambayo iko tumboni kwa mnyama itakutana na base ambayo ni dawa imeingia. Ile dawa ita undergo dissociation kwa sababu yenyewe dawa ndo imeingia kwenye tumbo ambako ndo kuna acid. Kwa hiyo itatokea dissociation na result itakuwa ni charged particles. Wakati unasoma cell membrane level 4, unasoma kwamba materials ambazo ni charged particles, they cannot cross membranes. They cannot cause semipermeable membranes of the cell. Kwa hiyo absorption inayotokea tumboni huwa inatokea kupitia cell. Na kwa hiyo materials za tumbo kwa huyu mnyama hazita cross kupata absorption. Kwa sababu gani? They are charged. Zile particles zinazotokana na ile dawa zime undergo dissociation, zimekuwa charged. Kwa hiyo haziwezi zika cross cell na kuwa absorbed. Kwa hiyo maana yake nini? Zile ions ambazo zimekuwa charged zitabaki mle kwenye stomach, hazitakuwa absorbed. Kwa kile kitendo cha zile ions kubaki mle kwenye tumbo bila kuwa absorbed ndo tunakiita ion trapping. Manake the ions of the charged basic drug has been trapped in the stomach of the animal. Kwa nini? Kwa sababu mnyama huyu alipewa dawa ambayo ni base, na hii dawa ambayo ni base ikakutana na acidic environment ya tumbo la huyu mnyama. Dawa ile ika undergo dissociation, ikatengeneza charged particles. Zile charged particles zikashindwa kuwa absorbed, kwa zikabaki mle tumboni charged ions, ambazo hizo charged ions ndo tunaziita zinatengeneza phenomenon inayoitwa ion trapping. So this means that xylene, furosemide, and phenylbutazone, they have large volume of distribution in the ruminants. So these compounds, they have a greater clearance in the ruminants than in non-ruminants. Tuendelee na hiyo concept ya acid and base hapa mbele. So the rumen of the ruminants. Kwa tumbo la hawa ruminants lenyewe linataka tu dawa ambazo ni acid. So the stomach of ruminants greatly favor absorption of weak acid drugs across their gastrointestinal tract. Kwa maana hiyo kwamba kama tumesema mnyama huyu akimeza dawa ambayo ni basic, ikifika tumboni ina dissociate, ina discharge, inakuwa charged particles, haiwi absorbed. Manake nini? Mnyama huyu akimeza dawa ambayo ni acid in nature na tumboni kwake kuna acid environment, hakutakuwa na dissociation. Kama hakutakuwa na dissociation na ile dawa ni weak acid, kwa ni organic material, inaweza ikaingia na kufanyiwa absorption, inaweza ikafika tumboni na kufanyiwa absorption kirahisi. So absorption in the rumen of ruminants occur only to weak acid drugs. So weak acid drugs will be absorbed in the gastrointestinal tract of ruminant animals, and the basic drugs will not be absorbed. Weak base drugs will not be absorbed in the stomach of the ruminants, because the stomach of the ruminants is acidic, and the weak base drugs, they will be producing ions, and those ions will be trapped with minimal absorption will occur. So in this situation that exists for weak acid such as penicillin, aspirin and phenylbutazone. Kwa hiyo dawa ambazo ni weak acid kama vile penicillin, aspirin na phenylbutazone zinaweza kuwa absorbed vizuri kwenye tumbo la huyu ruminant kuliko dawa ambazo ni weak base kama vile morphine, phenothiazines and ketamine. Hizi ni weak base, hazitakuwa absorbed kwenye tumbo la ruminant animal kwa sababu zenyewe zita dissociate na kutengeneza charged particles na phenomena ya ion trapping itatokea hapo. So in summary, we can say weak acid are readily absorbed from an acidic environment and sequestrated in an alkaline medium. Kwa hiyo weak acid, kama dawa ni weak acid, itakuwa absorbed vizuri kwenye tumbo la mnyama ambaye tumbo lake lina acidic environment. Lakini kama tumbo la mnyama huyo lina alkaline environment, ile dawa ambayo ni acidic haitakuwa absorbed kwenye tumbo la mnyama ambaye lina alkaline condition. Vivyo hivyo, dawa ambayo ni weak base itakuwa absorbed vizuri kwenye tumbo la mnyama ambaye tumbo lake lina alkaline environment au lina basic environment. Na weak base kama dawa haiwezi kuwa absorbed kwenye tumbo la mnyama ambaye tumbo la mnyama huyo lina acidic environment. So keep that in mind. And that is the issue of distribution. Then let us come to another concept. We have finished the issues of species variation and differences. Let us come to another issue of the effect of disease state on pharmacokinetic parameters. Tuone ni namna gani magonjwa, different diseases, can affect the pharmacokinetic parameters. Okay, let us begin with distribution of drugs, volume of distribution and half-life values. These are key factors that affect access, concentration, and the duration of action of drugs. So when we are talking of volume of distribution, half-life, these are very important factors to determine concentration and the duration of drugs. These parameters are usually determined in healthy animals. So how do the pharmacokinetic change in diseased animals? So if you see a half-life of a drug, if you see volume distribution of a drug, know that that particular parameter is found or was determined from a normal healthy animal. So what about the pharmacokinetic in a diseased animal? So what happens if the animal is diseased? There are some diseases that can affect these pharmacokinetic parameters. Diseases or effect of disease like fever. Fever is induced by toxins which are coming from the microorganisms. So these toxins, they induce fever, and by inducing fever, they increase intravascular distribution of ionized drugs like penicillins, cephalosporins, and the aminoglycoside, although without much effect on half-life values and the renal clearance. Bacterial infections induced experimentally in pigs can increase the volume of distribution of penicillin G, ampicillin, and decrease that of oxytetracyclines. So toxins that cause fever, in most cases, these toxins, they induce vasodilation. So these toxins, they cause vasodilation, because that's why sometimes fever is associated with headache, because the mechanism of headache is vasodilatation of blood vessels in the brain. Yeah. So if vasodilation of blood vessels in the brain causes headache, and the effect of toxins which induce fever, sometimes these toxins cause vasodilation of vessels. That's why sometimes fever is associated with headache. So if you increase the diameter of blood vessels, or you cause vasodilation, vasodilation reduces peripheral resistance. If it reduces peripheral resistance, it increases perfusion of blood to a certain organ. Kama mlisoma vizuri kwenye drug, kwenye blood circulation, mlisoma peripheral resistance, na mlisema kwamba peripheral resistance ikipungua, manake ni nini? Blood vessel imeongezeka ukubwa, peripheral resistance inapungua. Blood vessel ikiconstrict, peripheral resistance inaongezeka. Kwa hiyo pale vasodilation, manake tunaongeza diameter ya blood vessel, so peripheral resistance inapungua. Ukiongeza blood vessel, peripheral resistance ikipungua, damu nyingi ina uwezo wa kwenda kwenye hayo maeneo ya mwili. So perfusion, supply of blood to those organs increases. So damu nyingi inakwenda kwenye organs. Kwa hiyo hiyo ni effect ya vasodilation. Sasa ikiwa hivyo, manake ni nini? Damu inakwenda kule. Kwa hiyo kama kulikuwa na dawa kwenye damu, inasambaa kwenda kwenye hayo maeneo. So drugs like penicillins, cephalosporins, and aminoglycoside, yeah, it will increase the distribution of these drugs. The drugs will be distributed widely to different parts of the body. So different bacterial induced infections, they can also increase distribution of penicillins and ampicillins and oxytetracyclines, by the same concept of increased distribution due to vascular vasodilatation as the effect of endotoxins induced by various toxins of these bacterials. So the volume of distribution of penicillin, it probably increases because the permeability of the inflamed tissue barriers of penicillin increases. So sometimes fever is associated with the inflammation, and the inflammation can induce or can increase permeability of blood vessels and so forth. So drug distribution increase towards the areas or towards various areas. So a drug can be moved because they're to different parts because the permeability has been increased as the effect of inflammation. So the distribution of oxytetracycline may decrease because of the binding of the inflammatory exudates. And that is the effect of fever. Yeah. There is also effect of liver disease. We know that liver is a very important organ for drug metabolism. Various drugs are metabolized through liver. So if the drug is metabolized by the liver, we say the half-life of that drug is determined by the rate of metabolism of that drug. So if the drug is highly metabolized rapidly in the liver, means the half-life of the drug is very short. If the drug is metabolized very slowly in the liver, means the half-life of the drug would be long. So by so saying, if liver plays a major role in the metabolism of drugs, now if liver is diseased, if liver is damaged, it means the effect will happen to the metabolism of drugs. That means if the liver is diseased, drugs will not be metabolized in the liver as it is supposed to be. So in a severe liver damage, there is increased half-life of drugs. Drugs will increase their half-life because liver does not metabolize the drugs effectively. So the drugs will accumulate in the body, will remain in the body for longer time, and hence can cause toxicity. Kidney is a very important organ for elimination of drugs. So most of the drugs are eliminated through the kidney. And so saying, the half-life of the drug will be reduced if the will be increased if the kidney is diseased. So if the kidney is not well, that means the drug will remain in the body for a longer time, and it will increase the half-life of the drug and cause toxicity in that case, because the drug will accumulate in the body. So renal blood flow, the blood flow flowing towards the kidney, affects the three renal excretion mechanism. There is three mechanisms of renal excretion: glomerular filtration, secretion, and reabsorption. So the blood flow to the kidney affects the three processes of kidney function. So if the kidney is diseased, means it will decrease the elimination of drugs. By doing so, we increase the half-life of the drug, and also we increase toxicity of the drug in the body. So that is the effect of disease in the body. So by looking at the effect of disease in the body, let us see how different dose regimen happens in the animals. Different dose regimen in the different animals, how does it occur, those regimens? For each drug in each species, it can be efficacious and safe dose regimen, dose level, interval of administration, and dosing duration. And that efficacy and safety should be determined very well. So the dosage regimen may vary markedly between species, even when the doses are expressed by kilogram of the body weight. So dose regimen can vary between different species, even if we express those doses in terms of kilogram per body weight. For example, xylazine, an alpha-2 agonist used as a sedative, the effective dose is 10-fold lower in cattle than in horse, despite similar pharmacokinetic profile. So these drugs for example, xylazine, it has the same pharmacokinetic parameter or profile in horses, and it is the same as in cattle. But the dose of the same drug in cattle is 10 times lower than in horse. You see? So even they have the similar pharmacokinetic profile. Xylazine has the similar pharmacokinetic profile in cattle and horse, but the dose in horse is the dose in cattle is 10 times lower than in horses. So for morphine, the effective dose is 10-fold lower in cats than in dogs, because the dose of morphine in cat is 10 times lower than in dogs. We explained previously how does that come, or what is the cause of that. Aspirin dose is approximately 40 times higher in cattle than in cats. So the dose of drugs in cattle is 40 times higher than the dose in cats, and we explained previously what caused that. For succinylcholine or succinylcholine, a depolarizing neuromuscular blocker, the dose in cattle is some 40 times lower than in cats. So it is the same as for aspirin. The succinylcholine dose in cattle is 40 times higher than in cats. So for these examples, it seems that there's no generalization can be established between interspecies variations and certain physiological traits such as herbivores, carnivores, species of monogastric species versus ruminants. Yes, so we discussed a lot of species variations. Sometimes it can be due to physiological trait. Sometimes it's because it is a herbivore and some animals are carnivores. Sometimes because they have monogastric, some they have more than one stomach. So we cannot just say there is only one reason for interspecies variability. There can be various issues that contribute to interspecies variability, as we saw previously. So by concluding the species variation is that there are so many factors. We cannot conclude just one reason for species variation, but there are so many reasons for species variation in pharmacokinetic issues and pharmacodynamic issues of drugs, as we have seen the examples in the previous lessons. So let us come to a new concept, or the new issue that we can introduce now. Coprophagia, coprophagia or chorophagia. So coprophagia is another individual and a social behavior phenomena specific to veterinary medicine. There is a behavior in the veterinary medicine known as coprophagia. What does it mean? Coprophagia composes of the consumption of feces by animals. So animals, they eat feces. Many domestic species such as horses, pigs, rabbits, dogs, either regularly or occasionally practice coprophagia. So concept ya coprophagia manake ni tabia ya wanyama kula kinyesi. Kwa hiyo wanakula kinyesi, wanaweza akala kinyesi chao au akala kinyesi cha wanyama wengine. Hiyo inaitwa coprophagia kwa wanyama kama farasi, nguruwe, sungura, mbwa. Katika mida tofauti wanaweza wakafanya hiyo coprophagia. So if coprophagia happens, that may lead to drug transfer between animals, and that is known as allocoprophagia. Also a drug recycling when an animal re-ingests its own feces out of coprophagia and its own manure. Kwa tatizo la coprophagia ni nini? Coprophagia ni nini? Manake dawa zinakuwa excreted kwa kupitia feces. Kuna dawa ambazo excretion yake ni kupitia kinyesi. Kwa ile dawa ambayo inakuwa excreted kwa kupitia kinyesi, mnyama mwingine akila kile kinyesi, manake ile dawa inakuwa transferred kwenda kwa yule mnyama mwingine. Sasa au mnyama mwenyewe anakula kinyesi chake, manake kama alitumia dawa ambayo imekuwa excreted kwa kupitia kinyesi, atakapokula kinyesi chake tena, manake anakula ile dawa inarudi tena mwilini kwa mara nyingine. So the problem of coprophagia is that the drug is taken in again to the body or is taken by another animal. Na pale ambapo mnyama anakula kinyesi cha mnyama mwingine inaitwa allocoprophagia. Anapokula kinyesi cha mnyama mwingine, kwa hiyo dawa inakuwa transferred kutoka mnyama mwingine kwenda mwingine. Hiyo issue inaitwa allocoprophagia. Lakini mnyama anapokula kinyesi chake mwenyewe, manake ile dawa ambayo ameinywa yeye mwenyewe inatoka kwenye kinyesi, anaila tena pamoja na kinyesi. Hicho kitendo kinaitwa autocoprophagia. So jua hizo concept mbili za coprophagia. So the feces of treated fowls may contain extremely high concentration of antibiotics, especially for drugs which they have poor oral bioavailability. Mara nyingi kuna antibiotic nyingi sana zinakuwa excreted kwa kupitia kinyesi katika concentration kubwa. If such contaminated feces are ingested by an adult horse, ingested concentration of antimicrobial drugs may surface to disrupt the normal adult colonic microflora, which are exclusively sensitive to some antibiotics. Kwa kuna baadhi ya wanyama ambao wanahitaji sana wale bakteria ambao wanakaa kwenye matumbo yao. Hawa wanyama kama vile ruminants, kwa mfano horse, wanahitaji sana wale bakteria kwenye matumbo yao kwa ajili ya digestion. Sasa kwa mfano, tunaposema antibiotic nyingi huwa zinakuwa excreted bila kuwa metabolized. Zinapotoka kwenye kinyesi, mnyama yule akala kile kinyesi, ile antibiotic itakwenda na kuharibu wale microflora ambao wako kwenye tumbo la huyu mnyama. Kwa hiyo wakiharibu wale microflora, maana yake nini? Maana yake wanamletea shida huyu mnyama ambaye alikuwa na wahitaji wale microorganism kwa ajili ya digestion ya chakula chake. So the problem will happen. Na anaweza akapata kile ambacho tumekiongea kule nyuma, enterotoxemia. So the pharmacodynamics of drugs in different animal. Kwa pale huko nyuma tulikuwa tunaongelea pharmacokinetics and the variation of pharmacokinetics in various animal species, lakini pharmacodynamics pia inaweza ikaathiriwa na species mbalimbali za wanyama. So species differences in drug action and the effect, that is of pharmacodynamics, it reflects differences in target function, anatomy, physiology, and pathology, and or target receptor, including those of parasite and bacteria. In contrast with interspecies differences in pharmacokinetics, pharmacodynamics, interspecies differences are less numerous. Kwa hiyo pharmacodynamics, pharmacodynamics nasema tunaongelea what does the drug does to the body. Kwa hiyo tunaongelea jinsi dawa inavyofanya kwenye mwili wa mnyama, pharmacodynamics. What does the drug does to the body? So dawa hiyo inapoingia mwilini inaleta issue fulani katika maeneo mbalimbali ya mwili wa mnyama kwa kutumia target receptors. Kwa hiyo na hizo difference katika target inaweza ikawa ni anatomical target, physiological target or pathological target. So kwa tuone jinsi ambavyo wanyama wanaweza kutofautiana kwenye eneo la pharmacodynamics. Na hizo interspecies difference, huo tofauti katika species uko kwa kiwango kikubwa kwenye pharmacokinetics, lakini kuna kidogo kwenye pharmacodynamics. So example of myadriatic drugs with the parasympatholytic agent atropine being myadriatic in mammals but not in birds. Kwa hiyo kwa mfano, dawa zinaweza kusababisha effect ya myadriasis. Dawa zinaweza kusababisha effect ambayo inaitwa myadriasis, ambayo ni effect kwenye parasympathetic system. Kwa hiyo dawa ambayo inaweza kuwa ni myadriatic drugs, ambayo inakuwa ni parasympatholytic drugs, ambayo ni dawa ambayo inaondoa effect ya parasympathetic system. Kwa mfano atropine inakuwa ni myadriatic drug in mammals but not in birds. Kwa hiyo atropine, kazi ambayo atropine ni, badachana na hayo maneno ya parasympatholytic na nini ambayo hamkusoma kwenye basic pharmacology, nitairahisisha kwa maana hii. Atropine, effect ya dawa ambayo inaitwa atropine kwa mammals, effect hiyo haipo hivyo kwa ndege. Kwa hiyo dawa hiyo hiyo ina the same effect, ina effect fulani kwa mammals, lakini dawa hiyo haina hiyo effect kwa ndege. Kwa hiyo hiyo ndo interspecies variation. Dawa hii atropine huwa inaathiri iris muscles pamoja na ciliary muscles. Kwa hiyo hiyo effect inakuwa zaidi kwa mammals kuliko birds. So in birds, the iris and the ciliary muscles are composed of mainly of striated muscle fiber with an associated encodinic cholinergic neuromuscular. Kwa hiyo hizo muscles za iris na ciliary muscle za kwenye macho ya ndege haziathiriwi na atropine, lakini zinaathiriwa zile za mammals. So the drug will affect the muscles of the mammals than of the birds. And in mammals, the iris is composed of smooth muscle, and the muscarinic agonists act on the receptors of M3 subtype to cause pupil dilatation. Kwa hizo ni maelezo zaidi ya hicho ambacho nimekisema. Another examples of pharmacodynamic difference is the drug xylazine. This is an alpha-2 adrenergic agonist which is used widely in several species as a sedative. Is also a reliable emetic, particularly in cats, in which it stimulates the chemoreceptor trigger zone in the medulla oblongata, while it does not induce emesis in species such as ruminants and horses lacking the vomiting reflex. So unapoongelea dawa kama xylazine, inakuwa sedative kwa baadhi ya wanyama, sedative ina induce sedation kwa baadhi ya wanyama na species fulani fulani, lakini pia dawa inaweza kuinduce emesis kwa wanyama kama vile paka. Ina induce kutapika kwa paka anajisikia kutapika kimeza hiyo dawa. tofauti na wanyama wengine. So effect hiyo ya emesis haiko kwa wanyama kama vile ruminants, horses. Horse akitumia hiyo dawa hawezi kutapika. Paka akitumia anatapika. Umeona? Wanyama wengine wakitumia inasababisha sedation. So the same drug with different pharmacodynamic effect in different species. So hiyo ni mifano tu michache ambao tunaweza kuona ya kuhusu pharmacodynamics and the species differences. Kwa haraka haraka tuangalie routes of administration ambazo mmezisoma sana mkiwa level 4. Kwa hapa tutaziangalia tu kwa upande wa veterinary pharmacology. So there are different routes of administration. There is oral route with various advantages, very safe, convenient, economical, and so forth. May require drug to be mixed with food to facilitate administration. Food may stimulate bile secretion, which help in digestion of lipophilic drugs, which help in dissolving lipophilic drug to increase absorption. And those are the advantages. And disadvantages about acidic environment of the stomach can disrupt and destroy the drug, and the ruminant bacteria enzymes may be inactivated by drugs, and so forth and so forth. So these advantages, you know them through basic pharmacology. The rectal route advantages, you know them, and the disadvantages, make sure you look for disadvantages of the rectal route of administration. Parenteral route, which bypass or circumvents the GI tract. It bypasses the GI tract. So parenteral route, we are talking of intravenous route, intramuscular route, subcutaneous route, intraperitoneal route, and spinal or subdural injections used for regional anesthesia. Advantages of these routes and also disadvantages, because you studied them, or at least I can explain about the disadvantages. Disadvantages of the parenteral route is that asepsis is necessary to use it in a very safe manner without causing any contamination which can cause infection. So it should be used in a very clean environment to avoid infection, to avoid sepsis. So asepsis is necessary. It can cause pain at the area of injection. It can penetrate blood vessels during intramuscular injection. Intramuscular injection does not intend the reach to the blood vessel, but it can happen, the reach to the blood vessel, and that can cause problems. The speed of the onset is so rapid as with intramuscular and intravenous administration that cardiovascular response may occur to drugs which normally have minimal effect on the system. So you can have some other side effects of a drug just because it was given by intravenous administration. So in food animals, discoloration of the meat or abscess formation may occur to intramuscular injection, and this may be expected to devalue the carcass. So kuna baadhi ya wanyama ambao tunatumia kama chakula. Ukiwachoma sindano, yale maeneo ambayo yanachomwa, kwa mfano kwa intramuscular injection, yanaacha uvimbe, lakini pia inaweza kusababisha rangi ya nyama ya yule mnyama ikabadilika. So hiyo inasababisha matatizo. So ni disadvantage. Demo or topical route of administration. So the degree of absorption depends on the drug lipid solubility. So the abraded or damaged skin may be expected to absorb more drug than intact skin. So drug ambayo eneo la ngozi ambalo limepata damage au limepata shida kidogo, ile ngozi ya juu imekuwa abraded, ndo dawa inaweza kufanya kazi vizuri. Animals with thin skin like cats may absorb drugs like corticosteroids readily if they are applied topically. And animals with thicker skin, kuna wale wanyama wenye ngozi ngumu, dawa hii ya demo au topical haiwezi kufanya kazi vizuri. Wale wenye ngozi nyembamba, dawa hii inafanya kazi vizuri. So it is convenient and allows non-skilled operators to administer the drug by poor own method. Kwa ni rahisi, hata yule ambaye hana taaluma sana ya drug administration anaweza kuapply hiyo dawa. Inhalational route, mnafahamu hiyo route na mnajua faida zake na hasara zake. Vitu muhimu ambavyo natakiwa kujua, important key points in this part. You need to know the metabolism of drugs, what affects the metabolism of drugs. So the two types of metabolic reactions and other important parts that we discussed about species variations in every aspect of drug. And you can use these questions as evaluation questions. Know each of it, try to solve it. If you face any problem, you may ask how to answer these questions. You may ask, but make sure that you do it. Make sure that you solve these questions. You know them, the answers of every one of these questions. Make sure you know the answer for these questions. Thank you very much, and we shall see each other on session 3. This is the end of session 2.